Members of the public were given an opportunity Wednesday evening to weigh in on a proposed deal that would see Catholic Medical Center sold to an out-of-state for-profit healthcare company. Tennessee-based HCA Healthcare made a $110 million offer to buy out CMC. The public comment was part of an ongoing review of the proposal by the New Hampshire Attorney General's office. Supporters say the deal on the table could be the last best chance to save CMC, which has been mired in financial challenges for years. Documents filed with the state show the hospital operated at a loss in 4 of the last 5 years. It is currently hemorrhaging $2 million to $3 million every month. HCA currently owns 3 other New Hampshire hospitals: Frisbee Memorial, Portsmouth Regional, and Parkland Medical Center. At a public forum, members of the public, including current staff at CMC, voiced support and concern for the future under HCA. Doctor Patricia Furry, president of CMC Medical Staff and chief vascular surgeon, emphasized the sale would protect the long-term access to care at the hospital. I've been behind it from the beginning, and I continue to be behind it, Furry said. Without this transaction, I really fear for what we'll be able to provide for the city and to our patients, especially on the west side. While several community members thanked CMC and HCA leaders for their work on the deal, including Manchester Mayor and members of the City Board of Aldermen, others raised red flags about what they fear a future under the new owner would look like. Laura Zacher told the auditorium she was working at Frisbee Memorial Hospital in Rochester when HCA took over in 2020, and she noticed a decline in care and working conditions at the facility. I continue to hear promises of a regenerative hospital and a functional ICU, but I continually saw the complete opposite. Years after HCA's purchase of Frisbee, the hospital shut down its labor and delivery unit. Ella Kurt, a representative for a North Carolina nurses union, traveled to New Hampshire for the meeting to share her experience working for a hospital that was bought out by HCA. I watched CNAs being cut from out hospital. I watched admin assistants being dismissed, Kurta said. Jim Goldberg, who served as vice president of Frisbee Hospital during the sale to HCA and spoke in support of the deal, said in the current healthcare climate, standalone hospitals simply do not have the means to survive. You're not going to get everything you want, and you need to know that. But what is more important, I think, is to have health care and that network, that capacity of service, Gilbert said. Reporting live here outside CMC Hospital in Manchester, New Hampshire, I'm Riley King for WRMK News 12.